In this session, we've been looking at 3 different cases as to which is the right treatment option. The first case we have is somebody presenting with node-positive bladder cancer who goes on to have some downstaging chemotherapy. And then what is the right thing to do with these patients? Is it right to do a cystectomy to remove the bladder, or is it better to give them chemoradiation? And for that particular case, my personal viewpoint would be that this patient would have still a high chance of having metastatic disease in the future. So why not allow them to keep their bladder? We've got very good data on bladder preserving therapy by giving chemotherapy on top of radiation therapy in weeks 1 and weeks 4 of radiation, to show that you have the same disease-free survival with that as with cystectomy, with about a 50% 5-year survival, with a salvage cystectomy rate of about 14%. So the first case, I would strongly argue that they should keep their bladder. We're also looking at other cases, perhaps less fit patients and how well they do with treatment. And I think it's very important that we define what an elderly patient is in terms of fitness, what is their biological age, how well they might deal with other modalities of treatment. And we know from data from the BC 2001 study, which was a UK practice-changing trial in bladder cancer, that patients up to the age of 84 can be safely treated with these bladder-preserving protocols. And I think the majority of the session we're looking at the arguments behind surgery and the arguments behind bladder preservation with chemoradiation. My strong stance as a radiation oncologist would be, why not try and preserve your bladder if it has good function, if that's not going to ultimately offer you a poorer survival from your tumour. My stance is that why not keep your bladder? If it's not going to impact on how well you do in the long term, we know that there is no level 1 evidence really saying that cystectomy for many patients is any better or any worse than bladder preservation, and we know that we can maintain good quality of life for patients. So why not allow patients to keep their bladder?